Thank you for tuning in. On this webcast, we will be discussing implementing a tobacco-free and nicotine-free policy for your childcare. We will outline the steps and the best practices to make your childcare tobacco-free and nicotine-free. Our learning objectives on this webcast will be defining tobacco products and what they are, learning about the health effects, understanding the components of what is included in a tobacco-free and nicotine-free policy, with a goal to implement a strong and comprehensive tobacco and nicotine-free policy. The American Lung Association in Iowa serves as a community partner for the Iowa Department of Public Health Division of Tobacco Use Prevention and Control Grant. The counties we serve are Adair, Dallas, Jasper, Madison, Marshall, Polk, Union, and Warren counties. Tobacco-free and nicotine-free childcare facilities and homes is both a nationwide and statewide initiative. There is an IDPH community partnership in every county in Iowa. Clicking on this link will help you find your community partnership. Now let us examine the definitions of tobacco products. A tobacco product is defined as any product made from or derived from tobacco or that contains nicotine that is intended for human consumption or is likely to be consumed, whether smoked, heated, chewed, absorbed, dissolved, inhaled, or ingested by any other means, including but not limited to any component, part, or accessory, a cigarette, cigar, pipe tobacco, chewing tobacco, snuff, or snus. Tobacco product also includes electronic smoking devices, often referred to as vapes or e-cigarettes. The definitions of tobacco products do not extend to or include nicotine products approved by the U.S. Food and Drug Administration, the FDA, for tobacco cessation. Our definitions are comprehensive, which means that all tobacco products are covered with these definitions, even including products that have not hit the shelves or market yet. Now let us examine electronic smoking devices and define these products. An electronic smoking device is any device that can be used to deliver an aerosolized or vaporized nicotine or other substance to the person inhaling from the device, including but not limited to e-cigarette, e-cigar, e-pipe, vape pen, e-hookah. Virtually all electronic smoking devices contain nicotine. Nicotine is a chemical that acts as a stimulant in small doses. It is toxic in large doses and is the addictive component of tobacco. Here are some examples of tobacco products. There are combustible cigarettes on the top left. The device next to that is the Swisher Sweets Blunts, and the device next to that is a newer product called Heat Not Burn or IQOS. The far right picture is a hookah or tobacco water pipe. The bottom left picture is a smokeless tobacco, also called chewing tobacco. The bottom middle pictures are snus, chewing tobacco in a packet that does not require spitting. And the last picture is of flavored cigars. These are pictures of dissolvable tobacco products. Dissolvable tobacco products are mints, sticks similar to toothpicks, strips similar to Listerine mints, and orbs similar to Tic Tacs. You can see in these pictures that the dissolvable tobacco products look similar to everyday candy and mints. So let us take a closer look at electronic smoking devices. Electronic smoking devices are an umbrella term used to describe a variety of electronic devices that almost always contain nicotine, contain flavorings and other additives to the user, and oftentimes stimulate smoking. These products come in a variety of shapes, sizes, and they're continuously evolving. These are the types of e-cigarettes. As you can see, there are truly a variety of shapes and designs of e-cigarettes. All e-cigarettes function by a battery powering the device and a coil heating the solution. The liquid solution, which is found in the cartridges, becomes an aerosol, and it is the aerosol that is inhaled by the user. So here are some pictures of electronic smoking devices, or ESDs as they're sometimes referred as. ESDs use a lithium-ion battery. There have been many reports of them exploding on the charger and while in use causing injuries, burns, and even death. Injuries due to an overheating or malfunctioning battery. From 2015 to 2017, there were an estimated 2,035 e-cigarette explosions and burn injuries presenting to U.S. hospital emergency departments. In May of 2018, a 30-year-old Florida man died from a head wound caused by shrapnel from his exploding vape pen, and the first reported death in the U.S. attributed to a malfunctioning electronic cigarette battery. We have seen dramatic increase of use of electronic cigarette products among the youth. In just 1 year alone, the rates of e-cigarette use among 12th graders jumped 90%, from 11% to 20.9% of 12th graders reporting current use of electronic cigarettes. It also increased substantially among 10th and also 8th graders. On December 17, 2018, the National Institute on Drug Abuse released its 2018 survey results, and the numbers are even more startling than the National Youth Tobacco Survey data results from the month before. Researchers said that this increase is the single largest increase in the survey's 43-year history for any adolescent substance use outcome in the U.S. Vaping of any substance also increased substantially, reaching 26.7% among 12th graders. Now let us look at the health risks. When tobacco is ignited, many chemicals are released. In fact, there are 7,000 harmful chemicals released in the combustion process. Here is a list of just some of these chemicals. Arsenic found in rat poison and ammonia found in common household cleaners are just some of the chemicals found when tobacco is ignited. Smoking tobacco has many health effects. We have divided these into the short-term as well as the long-term effects. Some of the short-term effects of smoking tobacco might be shortness of breath, dizziness, mucus in the throat, increased heart rate, and increased blood pressure. The long-term health effects are it can cause lung cancer, lung disease, chronic pain, can affect your vision and cause blindness, cancer of the esophagus, and even chest pain. Now let us look at the health effects of chewing tobacco. So on the left, we have the short-term effects, like increased heart rate, bad breath, stained and discolored teeth, cavities, decaying teeth, and increased blood pressure are just some of the short-term health effects. The long-term health effects, it can cause tooth loss, gum disease, pancreatic cancer, cancer of the esophagus. It can also cause cancers of the mouth, the tongue, the cheek, the gums, stomach, and throat cancer. It can also increase the risk of heart attack. Now let us look at e-cigarettes. We discussed that e-cigarettes produce an aerosol. It is this aerosol that contains many harmful chemicals. The aerosol is breathed in by the user of the electronic cigarettes and also exhaled. The harmful and potential harmful substances found in this aerosol are volatile organic compounds, nicotine, ultrafine particles, heavy metals, cancer-causing chemicals, and also flavorings. The short-term health impacts of e-cigarettes are it can cause a dry cough, the aerosol can irritate the lungs, throat, and the eyes. It also increases the likelihood of catching a cold or the flu. E-cigarettes are a relatively newer product that made its entrance in 2007 in the US markets. These are the chemicals found in virtually all e-cigarettes. There are chemicals that can cause irreversible lung damage, including COPD, and may even cause asthma and lung cancer long term. We know that there are chemicals in these products that are known to cause cancer, can affect gene expression, and even impact the circadian rhythm. Many fires have been caused by the explosion of these devices. So e-cigarettes can cause unintended injuries. These are battery-operated devices that can malfunction and have resulted in serious injuries. Also, nicotine poisonings through nicotine exposure are also concerning. Children and adults have been poisoned by swallowing, breathing, or absorbing the e-cigarette liquid. As we have discussed, most e-cigarettes contain nicotine. We know nicotine has health effects. Nicotine is highly addictive. Nicotine is toxic to developing fetuses. Nicotine can harm adolescent brain development, which we know the brain continues to develop until the mid-20s. Nicotine is a danger to pregnant women and their developing babies. We know women who smoke are more likely to have infertility, loss of pregnancy or bleeding, complications with the placenta, preterm labor, and premature birth. The chemicals and toxins from smoking are passed to the baby. The carbon monoxide prevents the baby from getting the necessary nutrients and oxygen. And then babies who are exposed to smoke during pregnancy are more likely to have low birth weight, increased heart rate, decreased lung, heart, and brain development, ADHD, learning problems, asthma, ear infections, just to name a few. In a recent report dated January of 2018, the prestigious National Academies of Science, Engineering, and Medicine released an analysis after reviewing major studies on e-cigarettes. The bullet points in the slide show their main conclusions. E-cigarettes cause health risks. They increase the chances that children and youth will start to use combustible tobacco products and expose others to dangerous secondhand e-cigarette emissions. Let's review the nicotine poisonings. Ingesting tobacco products is a major reason for toxic exposure in infants and children reported to poison control centers. Please have information on the Iowa Poison Control Center available at your childcare center or home. The phone number to contact them is 1-800-222-1222. A 1-year-old child died from liquid nicotine poisoning in December of 2014, the first such death in the United States. The bottles are sold in various sizes, from 10 milliliters, about 2 teaspoons, to more than 30 milliliters, which is about 6 teaspoons, and come in a variety of nicotine strengths. And just 1 teaspoon of concentrated liquid nicotine can be fatal for the average 26-pound toddler. So some nicotine poisoning systems to look out for are vomiting, a fast heartbeat, jittery and unsteady appearance, difficulty breathing, increased saliva. Tiny amounts of e-juice, whether ingested or absorbed through the skin, can cause vomiting, seizures, and be lethal. And exposure means someone has had contact with the substance in some way. For example, ingested, inhaled, absorbed by the skin or the eyes. The reported exposures of 2017 are not final. We'd also like to make a distinction or talk about secondhand smoke, but also let's talk about third-hand smoke. So here are the definitions. Studies show that third-hand smoke clings to hair, skin, clothes, furniture, drapes, walls, bedding, carpet, dust, vehicles, and other surfaces, even long after smoking has stopped. Infants, children, and non-smoking adults may be at risk of tobacco-related health problems when they inhale, ingest, or touch substances containing third-hand smoke. Third-hand smoke residue builds up on surfaces over time, and it resists normal cleaning. Third-hand smoke can't be eliminated by airing out rooms, opening windows, using fans or air conditioners, or confining smoking to only certain areas of a home. So this includes toys, blankets, car seats. Children are exposed to third-hand smoke as they breathe near, crawl and play on, and touch and put in their mouth surfaces and objects that are contaminated. And low levels of toxins can build up to dangerous levels in the body. We know that infants and young children exposed to secondhand smoke can experience these health effects. The remainder of this presentation will focus on tobacco-free and nicotine-free environments and how to implement a policy for your daycare center or home. The American Lung Association has a model policy that we are more than happy to share with you that you can implement for your center or for your home. We also provide free technical assistance to assist you with writing a policy that works best for your childcare. It is important for this policy to be an at all times policy, meaning 24 hours a day, 7 days a week. Because this protects children from secondhand and third-hand smoke, it also motivates tobacco users to quit. So why is it important to have a tobacco-free and nicotine-free policy? Why not just smoke-free? Well, it protects children from secondhand and third-hand aerosol of electronic smoking devices. It reduces the chance of nicotine poisonings, and it provides a good example. Having strong written policies just makes good sense, but it also strengthens your Iowa's quality rating system rank and ChildNet certification. So is there support for tobacco-free childcare? Yes, there's lots of support. These are just some of the organizations that support it. Parents want their kids protected from tobacco and also want a healthy example set for their kids. So this contains some vital information about the Smoke-Free Air Act pertaining to childcare facilities, childcare homes, as well as the Iowa Department of Human Services rules. The policy we're talking about today is stronger than the Smoke-Free Air Act pertaining to childcare. We're happy to share this information to have your childcare have the best possible tobacco policy. So these are 3 major reasons to implement a strong and comprehensive tobacco-free and nicotine-free policy for your childcare. Update existing smoke-free policies, improve the health of all employees and visitors, and reduce employer costs. So making the case specific to point 1 includes upgrading smoke-free policies. Tobacco and nicotine-free policies are a priority because employees that smoke may replace their cigarettes with smokeless tobacco or non-FDA approved nicotine products during times when smoking is prohibited. We have been referring to tobacco and nicotine-free policy to be sure to be comprehensive and address the latest trend of electronic smoking devices. So tobacco-free, nicotine-free policies protect children from secondhand and third-hand smoke, prevent nicotine poisonings, and prevent children's exposure to tobacco products. The second case is for the case of health. So to improve the health of employees and visitors. So these are the current tobacco use statistics for Iowa. And then these stats are nationwide statistics, but portray the picture in Iowa as well. Smoking is the leading cause of preventable death and disease in Iowa, the US, and worldwide. Nearly 1 of every 5 deaths each year in the United States is tobacco-related. And lung cancer is a leading cancer killer in both men and women in the US. Cigarette smoking is linked to about 80 to 90% of lung cancer deaths. Cigarette smoking kills more than 480,000 Americans each year, and more than 16 million Americans are living with tobacco-related disease. And secondhand smoke kills more than 41,000 people in the US each year. We know that tobacco-free and nicotine-free policies benefit everyone. They create a safe and healthy work environment. They demonstrate your childcare cares about safety and health. Children, visitors, and workers are protected from secondhand smoke and third-hand smoke. The policy truly motivates tobacco users to quit. It enhances overall health and wellness of children, visitors, and employees. According to the Community Preventative Services Task Force, tobacco-free and nicotine-free worksite policies reduce consumption by continuing smokers, increase smoking cessation attempts, increase the number of smokers who successfully quit, and reduce the prevalence of tobacco use among workers. Tobacco users cost employers in terms of increased absenteeism, reduced productivity as a result of nicotine addiction, missed work time due to smoke breaks, and increased healthcare expenses. The third point is for making the case is regarding cost savings. For each employee that quits smoking, there's an average cost savings of $5,800 annually. So the range is anywhere from approximately $3,000 to $10,000 per every year the employee works for you. These changes are seen in increased productivity, less sick days, decreased healthcare costs, and pension benefits. So there are so many reasons to consider implementing a tobacco-free and nicotine-free worksite policy. Here's a list of benefits specific to the employer. We know now why and how a tobacco-free worksite policy will benefit you, but the big question is, how do you go about actually implementing a policy change? That's where we come in. One of the biggest questions we get is, when should we make this change and how? It really comes down to a few simple steps and a detailed timeline. In our Worksite Toolkit, which you will have access to, there's a sample timeline. We can take that timeline and work with each individual daycare and daycare home and daycare center to create a specific timeline for your needs. Every daycare is different. Some locations like to implement within 3 months, others like to implement in 6 months or even a year. We will work with you to decide what's best for you and your daycare. So the first step is to determine the messaging that you will utilize and to select a timeline and implementation date. Some other steps to consider is reviewing health insurance options for employees and also cessation product coverage. At the American Lung Association, we will provide you with ongoing support, education, enforcement, and also signage as well from the Iowa Department of Public Health. A huge piece of the implementation process is to provide employee education on what this policy entails and when it will take in effect. We really stress education. We cannot stress enough how important it is to educate not only your employees, but visitors as well. And education can come in many different forms. Mass emails regarding policy update. If you have a website or social media, you can also include this information there. Sending out mailing pieces and flyers to all your employees and also the parents, including information in new employee orientation packets as well as visitor information packet. And community education is also important, letting the community know of this policy change by posting an article in your local newspaper. Also, you will need to remove all smoking huts and ashtray receptacles, if applicable, to your company and hang up the signage. If you're an in-home daycare provider and this policy does not fit your business, please contact us directly. We would be happy to help you write a policy that maintains its integrity, but also fits your business. To qualify for the special signage, your policy must extend to the entire childcare property to receive this metal signage and clings for your home and for your vehicles. Again, we serve 8 counties. The resources we provide are specific to businesses within our service area. However, all counties in Iowa have a community partnership grant that provides similar services to what we do. If you're a business outside of these counties, let us know and we'd be happy to give you the contact information for the community partner in your county. What our grant can provide is toolkit, policies, free cessation resources, and free signage. Some other free resources we can provide: free technical assistance with policy change. You're eligible to receive a free marketing piece highlighting the policy change to tobacco-free, nicotine-free. We can provide you notification letters for parents and staff to assist with the policy change. And our tobacco cessation handout and resources are available at no cost. These are the 3 quitting resources we promote the most in our work. Really increasing the number and types of interventions results in an increased opportunity for successful quitting. Quitline Iowa is a great resource that is toll-free and statewide that provides tobacco cessation telephone counseling services. Trained counselors provide assistance in making an individualized quit plan and provide ongoing support through optional follow-up calls. You can call today for free tobacco cessation resources and to get the support that you need to quit. Quitline Iowa is available 24/7. The phone support is available whenever you need it from expert and caring coaches. The quit support is available via the web, text messaging, and also via email. Quitline Iowa will send you an easy-to-follow workbook to help you create a quit plan that works exactly for you. There are also quit aids available that can help you become tobacco-free. The coaches can help you pick the best quit plan for you. Quitline Iowa can be reached at 1-800-QUIT-NOW or by going to their website at www.quitlineiowa.org. So overall, a tobacco-free policy creates a positive company image, protects non-smokers from the effects of secondhand smoke, and helps tobacco users quit. When implementing a policy, it is important to establish a comprehensive policy and educate employees and visitors and post proper signage. If you're interested in moving forward with a policy, the next step would be to contact us. We would love to meet with each of you individually and create an action plan that fits your company's needs. We are here to help every step of the way and make it as easy as possible for you. Thank you for joining the webcast today. Please reach out to the American Lung Association for any questions and to connect you with the community partnership in your area. We can be reached at 515-309-9507 or by email at info@lung.org.